Self-massage mistakes all runners need to avoid. Hi, welcome everybody. It's Jason Barlow, RMT, and I'm here today as your therapist and as your coach to help you transform any stress, your tension and pain into health, happiness, and vitality instead. Welcome back. This week, exploring self-massage methods, especially for runners, and what it is that they need to avoid by way of mistakes that are commonly at place. So being a massage therapist for nearly 20 years, I was going to say 30 years, I was going to age myself a little prematurely there. 20 years, I've seen a lot of injuries, a lot of variety of injuries. Typically, the most common that I see coming in orientate towards the low back, the hip, followed by the neck and shoulders, a very close second. And then we get into some extremities. Then we get into jaw and facial pain and foot pain and so forth. But generally speaking, the bulk of people that come in that I'm treating, especially over my nearly 2 decades, have been in that general low back, hip, and then upper back, neck, shoulders. And it ties in together, as I talk about in my new book, the 15-step playbook for pain relief, which if you do not have a copy, you should go get yourself a free digital copy while you still can. We've been a bit delayed on removing the book completely from my website. That's going to be happening here in the coming months. And with that, there's actually going to be a program that you can follow. And the book is no longer going to be free. It'll be part of this package that we're offering. Anyway, that's to come. Just keep an eye on the website. But for now, you can still get a digital copy. Just go to my website. Within that, I want you to explore more about your posture, because the upper posture is highly influential upon the lower posture and vice versa. What you choose to eat, how you choose to think, how you choose to rest and recover, and how you choose to move or not move are also elements that you can have control over. You just got to know how to control them and what to do about it. And that's what I teach you, the how-tos in my book. It's 15 steps. It's a really short book. I condensed it because I realized that, especially for myself, I'm a busy parent. How can I condense what I've learned over the last 2 decades into a format, into a method that people can quickly chew and swallow in, and also then apply it and get some pretty radical results? Have I sold you on it? If I haven't, then why are you here? What are you listening for? Hopefully you're listening to get information from me. Well, what's the best way to get information from me? Go to my website, download the book, listen, and ingest even more. And then you should also, if you're enjoying this one, go back and review my past 127 episodes that I put into a podcast format for you, or onto my YouTube channel. You can just go to the playlist, Playbook for Pain Relief, which is the playlist specifically for my playbook. And then from there, you can go through everything that I've been talking about over this last 7 months, I guess. Anyway, let's get into today. Now, in the description below, you'll see there's 2 links. One is for the blog article, which I reviewed and talked about this topic last summer. And also you'll see a YouTube link, which is going to teach you the very method of how to do this particular massage I'm talking about. So I guess what I should review first is, what are the common self-massage mistakes? Because that's the essence of the title here. So when I'm teaching this to my patients, I always recommend that they get a suitable roller. Now, there's different thicknesses. There's a 4-inch, there's a 6-inch, there's probably even ones larger than that. There's ones with knobbly bits on it. There's ones that are smooth. You know, which one's right? You know, at the end of the day, try, experiment. I just have a flat one that's 4-inch. I have one that's maybe 5-inch, but it's a firmer roller that's got kind of a cushion over a plastic piping. I mean, if you've got the time and the inclination, you can absolutely make your own form and versions of these rollers that we're describing. Just Google them, get some ideas. There's a whole spectrum of ones that are out there. I wish I could say, yeah, you definitely want to go get this one, and here's the one that I endorse. No. There's a spectrum out there. Go dabble, experience, experiment. Now, the most important thing is that when you're doing it, you're on the type of surface that's going to give that feedback or that pressure where it needs to be. So as a massage therapist, if my cushions are too soft on my table, I'm putting energy into the patient. The energy is being dissipated through into the table. And it's the same when you get a foam roller. If you go put it on a rug on the floor or your carpet and you roll on it, that's dissipating some of the energy. You've got to get it onto a harder surface, a thin yoga mat on a hardwood floor or a laminate floor, or in a yoga studio or a workout studio. That's going to be best, because that way then there's less give in the floor and there's more energy coming back through that roller into your body where you need it to actually go. And so what I'm suggesting here is you get yourself a good roller that's going to do the job and experiment and is going to help you out. The other tool that you could consider getting into is what we call a percussive massager. Now, the percussive massager is just another adjunct. You could use the two together, or you could pick one or the other. Do you want me to answer which is my favorite? It depends on the day. If I've got more time and I've got the energy in my body after a busy day of massaging people, I'll get my percussive massager. If I don't have as much time, if I've not got as much energy, then I'll use my roller. And again, I judge it on what my body needs any given time as to what area I'm going to be centering in on. So the other element that I want you to then progress from knowing that you need these tools is then recognizing the anatomy that you're dealing with, especially here, because what I'm encouraging you to do by way of massage in the video specifically below is to massage your IT band, your iliotibial band or iliotibial tract. Now, you should go check out my article because I give you a little bit more of a breakdown of the anatomy there and the musculature and how it attaches and so forth. And you can see how it blends. This is the important note about the IT band, is that in and of itself, the IT band doesn't really get too adhere. It can, but it's really by virtue of what's happening in the musculature that it's connecting with above. So that is the tensor fascia latae on the front side in the hip flexor and your gluteus maximus on the posterior. So that's the IT band becoming these two muscles on the upper side of the hip. The IT band carries on down to the outside of your knee. So it can cause knee pain, hip pain, back pain. It can cause dysfunction at the knee, dysfunction at the hip, and cause some, skewing, if you will, of the alignment of the hips. And it's an important one that especially females, generally speaking, females, you will have a slightly wider pelvis than you would your knee position. And that's what we call the Q angle. More often than not, most females have a slightly increased angle of what we call the Q angle, which means that if you were to lay on your side and put your knees together, if there's a sharp angle from the top of your hip on the outside of the pelvis to the outside of your knee as it travels down towards the bed, the larger that angle, the greater your Q angle, the more likely you're going to have IT and hip issues. And that's why I recommend to, well, everybody, but especially females, when you lay down in bed and you're sleeping on your side, always put some pillows between your knees to make sure that the knees are aligning with your hips and pelvis, the width of which is determined by, how many pillows you put in there. So you don't want it to go into external rotation, too many pillows, but you do definitely want to have it aligned, and that's really going to help mitigate the stress and demand upon the IT band. So diving more into the IT band specifically, what we're doing here is we're essentially putting quite a deep pressure onto that band just above the knee to just below the bony protuberance we call the greater trochanter on the outside of your hip. Now, again, you might have just listened to this on a podcast. Great. And you're on your way home. When you get home, definitely go pull out the YouTube link below, copy and paste it into your browser and follow the video because I narrate and I show you exactly what to do and how to do it. Guess what? You got to go do it. Nobody's going to come and do it for you. I can't come and make you do it. Well, I could if you pay me more. But the point being, you might be somewhere in Australia. Well, pay me and I'll come to Australia. How about that one? But the point being, you got to do this for yourself and try and experiment it, because you could go on Google right now and go, should I foam roll my IT band? And you'll get some that will argue yes and some that will argue no. And I'm all about empirical evidence, scientific proof. You go experiment and try it for yourself. Follow the guidelines, because if you don't follow the guidelines, I guarantee you are going to hurt yourself. You are going to injure yourself if you continue to do that, because there is a bursal sac just below this greater trochanter that we're talking about. And that's why this is a delicate area that we've got to be attentive to and understand the anatomy of. So experiment, try it, test it, and get a sense of what it's doing for you. So we've got to have enough pressure applied to that area to get the reactions that we need. That's going to generate more pressure, more heat to the area. It's going to generate more blood flow to the musculature, especially. And as soon as you start to get reactions from that musculature, naturally, as a byproduct, the IT band is going to start to loosen and relax its grip that it's got at the current time. So we've got to make sure that we're getting the right amount of duration of the massage that we're doing and frequency. If you just do this once a month, it's not going to do much. If you come in for once a month and you're in symptoms, it's not going to do very much. It can help, but that pressure is all important. If you are not going to do it very frequent, then you definitely want to go higher levels of pressure, as I talked about in my video. But again, the caution to that is don't apply that pressure when you go onto that greater trochanter, the bony protuberance, or into the knee. It's almost free reign in between, and your body will communicate pretty quickly to you. And if you're anything like me, or anybody like me, you will not put as much pressure yourself on your own body as you would tolerate if you went to a therapist who was doing that directly for you. And that's even for me as a massage therapist. I'll let my massage therapist do way more pressure, my chiropractor do way more pressure than I will do and tolerate and durate, if you durate, is that even a word? Allow the duration of when I'm actually doing it to myself. So hopefully you found some benefit. You understand that there's actually some elements that you need to avoid when it comes to self-massage, and there's some mistakes that people commonly make. But once you understand what those mistakes are, as a runner especially, because runners usually do so much mileage in a given week, they're building up a lot of tension in this IT band. But that doesn't mean it's only runners. Somebody who's more sedentary, who's driving a lot, commuting to work, or sat in the office, or sitting more just generally this past year with COVID protocols going on, is you will need to, I recommend, go get one of these rollers, experiment and test if this is something that's beneficial for you. Because even if you're symptom free, you might be listening to this going, nah, it doesn't really apply to me. Whoa, test it. Just because you're not in pain doesn't mean you're not in pain. What I mean by that is I can stimulate pain in your body very quickly by identifying muscles that, whoa, these are really, they're building up. It's like a volcano that's dormant right now. And one day it could erupt. And that's why we see patients come in that have picked up a tissue off the floor, or they picked up tied their shoelaces, and they go to stand up and bam, their back is blown out. It's not that was the cause. You've done that countless times. What is accumulated is all that tension in the background, what I call in my book, postural debt. So thank you very much for joining me. I hope you found that a benefit. I've got to go. Why? Because England are playing right away. I want to go catch this last game that they have to get a win or at least tie, and the other teams have to. Anyway, if you're following, come on, England. Here we go. All right, take care. Remember, your muscle health is my #1 priority. If you've liked this video, like it. Give me a thumbs up. Give me a little comment. Share this video. Give me a review. Help me spread this message. Take care. Have a great rest of your day.